Good morning, everyone. I'm delighted to welcome you all today. Today, we will be exploring a very important topic: how to handle human errors in pharmaceutical manufacturing. My name is Dr. S.K. Singh, and I hold a PhD in this field. Over the next few minutes, we'll discuss strategies to identify, prevent, and manage human errors to ensure safety and quality in our industry. So, let's get started and make this session both informative and practical for your work. Let's begin by looking at the title of this slide: Introduction. As we all know, technological innovations and operational excellence have truly transformed industries, setting new benchmarks for efficiency and quality. However, despite these advancements, human error remains a significant factor, especially in the pharmaceutical manufacturing industry. It's become a common root cause behind many failures and deviations we see today. There are various factors that contribute to failures. Things like equipment, material, method, and environment all play a role. Yet, surprisingly, a large number of deviations and failures are still attributed to human error or personnel mistakes. It's important to understand that human error isn't just about individual mistakes. It often reflects deeper issues within the system. Recent regulatory inspections have reinforced this point. Investigations often conclude that human errors are caused by systemic issues rather than individual negligence. Regulatory agencies challenge the notion that human error is the root cause. Instead, they emphasize that human error is often a symptom of larger systemic problems. So when we talk about human error, we need to recognize that it's not truly the root cause. It typically originates from system design flaws, inadequate procedures, insufficient training, or an environment that doesn't support safe and compliant work. Rather than blaming personnel, organizations should focus on improving these controllable factors. By investigating and addressing underlying system weaknesses, we can reduce errors and enhance overall process reliability. This approach aligns with our broader goal of fostering a culture of continuous improvement and systemic safety. When we talk about human error, we're referring to any human action or even a lack of action that goes beyond what a system can tolerate. It's important to understand that errors can happen when someone is performing their job, whether it's a mistake in judgment or simply doing something differently than planned. Human error also includes states or conditions where someone is wrong in their conduct, which can lead to a failure in achieving the expected result. These mistakes are quite common and can happen to anyone, especially when the planned sequence of mental or physical activities doesn't go as intended. When this happens, the outcome may be undesirable or simply not what we expected, and it can significantly impact the quality and safety of the product or process. So, understanding human error is crucial because it helps us see how even well-meaning actions can sometimes lead to mistakes, and how important it is to design systems that account for these human factors. On this slide, we're focusing on the importance of properly handling human error within our pharmaceutical quality systems. When human error is suspected or identified as the root cause of a problem, it's crucial to justify this assessment carefully. We need to make sure that we haven't overlooked any process, procedural, or system-based issues that could be contributing factors. If errors are found, appropriate corrective actions and preventive measures, often called CAPAs, should be identified and implemented. It's not enough to just act. We must also monitor and assess the effectiveness of these actions to ensure they truly resolve the issues. This approach aligns with the principles of quality risk management, emphasizing continuous improvement and vigilance. Similar guidance is echoed across standards like the PIC-S guidelines and the European Union's GMP regulations, all underscoring the need for thorough investigation and justified conclusions when human error is involved. Ultimately, the goal is to ensure that errors are addressed comprehensively, preventing recurrence and maintaining the integrity of our medicinal products. On this slide, we see that foreign matter was identified as a known process-related defect. For example, pouring PVP from the cut polybag into water during mixing can sometimes introduce a fragment of the polybag itself. However, despite identifying this, no specific root cause for the particulate was pinpointed. The most likely reason we failed to identify the critical or major defects during 100% visual inspection is human error. This highlights how human factors can significantly impact our quality control process. Looking at the data, we noticed a high percentage of invalidated OOS test results, about 77%, that were not followed up with appropriate investigations. This was mainly attributed to human error, but also involved instrument and method errors. It's important to note that the term human error was intentionally used here to avoid implicating faulty method validation or qualification processes. When we examine the laboratory investigations, they often lacked a solid scientific rationale for determining root causes. While contamination and analyst error were frequently suggested as probable causes, these conclusions were sometimes made without thorough scientific backing. Furthermore, CAPAs, or corrective and preventive actions, were often limited to retraining analysts. There was little evidence of systematic improvements to analytical methods, such as adjusting sonication times or solution hold times, or upgrades to equipment to enhance overall robustness and prevent errors from happening again. Finally, under regulatory observations, it's clear that human errors continue to be a significant concern. Addressing these issues requires more than just retraining. We need a comprehensive approach to improve methods, validate processes thoroughly, and reduce the likelihood of human mistakes affecting our quality. When we talk about human error as a root cause, it's important to ask ourselves whether it's always the right thing to do. Often, human factors are involved, but there might be deeper issues at play that need to be explored further. Just attributing a failure solely to human error can oversimplify the situation and overlook other contributing factors. In fact, some companies go as far as to exclude human error from their list of root causes altogether. They recognize that what appears to be human error is often a symptom of underlying system flaws, inadequate training, or poor procedures that provoked that error in the first place. Especially in FDA-regulated manufacturing environments, genuine human errors do happen. But interestingly, these errors are sometimes cited more frequently than they probably should be. This tendency can lead us to overlook systemic problems that need addressing to prevent future failures. Now, a more complex question is whether intentional acts, like violence, should even be considered human error. These are deliberate actions, not mistakes or slips, and they require a different kind of analysis altogether. So, when we talk about human error, we need to be cautious. It's a real challenge because it can sometimes serve as a catch-all explanation, but it also pushes us to dig deeper. We must ask ourselves, are we truly understanding the root cause, or are we just stopping at the easiest explanation? Understanding human behavior is a challenge because it is inherently complex. People do make mistakes or errors simply because they are human and can be prone to slip-ups. So, why do humans make mistakes or errors in the first place? Well, these can happen either intentionally or unintentionally. If the mistake is deliberate, it might be driven by various root causes, such as lack of awareness, motivation, or even pressure to meet certain targets. On the other hand, unintentional errors often stem from factors like fatigue, distraction, or inadequate training. When we investigate human errors, it's crucial to consider these underlying factors thoroughly. Identifying the root cause helps us determine effective corrective and preventive actions, or CAPA. And of course, we need to evaluate the effectiveness of these CAPA measures to ensure they truly prevent recurrence. This flow of understanding human error, recognizing the causes, and implementing targeted CAPA is essential for improving safety and overall process reliability in any system. On XXX, during the sample preparation process for XXX tablets, which we were conducting to evaluate blend uniformity for the intermediate product, we encountered some issues. Out of 30 samples prepared, 2 samples, specifically sample 5 of set 01 and sample 3 of set 02, were spoiled. Now, focusing on the blend uniformity results, we found that the samples from set 02, which included samples 1, 5, 6, 7, and 9, did not meet the acceptance criteria. This indicates that there was some inconsistency in the blending process or sample handling. Moving on to the root cause analysis, we identified that the problem with sample 5 of set 01 was due to the volumetric flask breaking during stirring. This likely compromised the sample's integrity. For sample 3 of set 02, the issue was an error during the volume measurement. Specifically, overvolume was used, which affected the sample's accuracy. Further investigation revealed that during sample preparation, the volumetric flasks were accidentally interchanged. This simple error, a human mistake during the process, significantly impacted the results. This incident underscores the importance of meticulous sample handling and the need for strict adherence to procedures to prevent such errors in the future. It's a clear reminder that even small mistakes can have a big impact on our data quality and overall process integrity. Today, I want to walk you through an example of human error from a laboratory investigation, specifically LIR example 2. On a certain day, let's call it XXX, we conducted testing on a particular sample. The sample's details were a specific color value associated with a lot number XXX, manufactured by XXX. During the testing process, we observed that the sample solution showed negative absorbance. Now, negative absorbance is unusual because, in theory, absorbance should be 0 or positive. Negative values often indicate an issue or error in the measurement. The root cause of this problem was identified as a failure to perform blank correction during the measurement on the UV-Vis spectrometer. Blank correction is a crucial step because it helps account for any background signal or interference. Without it, the readings can be misleading, as was the case here. This example highlights how a simple oversight, missing a blank correction, can lead to inaccurate results and potentially impact the overall quality and reliability of laboratory data. So, recognizing and preventing human errors like this is vital for maintaining the integrity of our testing processes and ensuring accurate, trustworthy results across all laboratory activities. On this slide, I will walk you through the details of the incident that occurred during the IR scan of the XXX USB RS, specifically RSXXX. So, on a certain date, during the scanning process, we noticed that the spectrum obtained did not match the expected control diagram outlined in our approved test method. The analyst performed the scan and observed this discrepancy firsthand, which prompted further investigation. The root cause of this issue was identified as a thin film of paper that was attached to the surface of the XXX USB RS. Importantly, this was something the analyst did not notice prior to starting the analysis. This small but significant oversight led to the spectrum mismatch. This situation highlights a human error, which is a common factor we encounter in laboratory investigations. It's a reminder of how critical careful inspection and attention to detail are in our testing processes. Recognizing these types of errors helps us improve our procedures and ensure the accuracy and reliability of our results. Let's walk through the key steps involved in human error investigations in pharmaceutical manufacturing. First, we start with understanding the background of the incident, gathering all relevant context to set the stage for our investigation. Next, we conduct a Gemba walk, which means going to the actual location where the error occurred, to observe and gather first-hand insights. Then, we move on to interviews, using a predefined questionnaire to ensure we gather consistent and comprehensive information from the involved personnel. Photographic evidence can also be very helpful in documenting the scene and the specific circumstances of the error. If applicable, we develop an approved hypothesis plan that guides our investigation and helps us focus on the most probable root causes. Choosing the right tools, like Y-analysis or other appropriate methods, is crucial to analyze the situation effectively and identify underlying issues. We also utilize a human error checklist to systematically evaluate contributing factors and ensure we don't overlook anything important. Determining the root cause involves classifying it into specific categories, which helps in tailoring our corrective actions. Assessing the impact or risk associated with the error is essential to prioritize our responses and mitigate any potential harm. Based on our findings, we implement corrective and preventive actions, or CAPA, to address the root causes and prevent recurrence. Finally, we need to consider where CAPA applies, whether across a particular department, site, or system, to ensure comprehensive and effective resolution. All these steps are interconnected and vital for maintaining quality and compliance in pharmaceutical manufacturing, especially when handling human errors. Let's talk about fostering an open mind, open talk, and a culture of discussion. It's essential to move away from the mindset of blame and instead focus on understanding and improvement. When addressing human errors, we need to look at system controls. Are they effective? We should also consider additional checks that could catch mistakes early. Behavior plays a vital role, so encouraging a culture where everyone feels comfortable speaking up is key. Getting the right work to the right person is fundamental, ensuring tasks are assigned appropriately. We also need to evaluate the effectiveness of training programs. Are they truly preparing staff? Equipment limitations, like space constraints, can hinder performance, so addressing those is important too. Workflow availability must be checked. Are processes streamlined and accessible? Work allotment should be adequate. Overloading staff can lead to mistakes. Resource bottlenecks, whether manpower or materials, need to be identified and resolved. Procedural clarity is crucial. Everyone should understand the steps and expectations. Clear assignment of roles and responsibilities helps avoid confusion. And of course, communication should be transparent and effective. This keeps everyone aligned and minimizes errors. Finally, when proposing CAPA, or corrective and preventive actions, keep these points in mind. Think about the root causes, the system improvements needed, and how to prevent recurrence. It's all about creating a culture that focuses on learning and continuous improvement rather than blame. Now, let's delve into some key considerations for effectively handling human errors in pharmaceutical manufacturing. First, work culture plays a critical role. Creating an environment where employees feel responsible and supported encourages proactive error prevention. Simplified procedures are also essential. The more straightforward the process, the lower the chance of mistakes. Next, it's important to review the previous CAPA effectiveness. Analyzing past corrective actions helps us understand what really works and what needs improvement. Tying this into trend report references allows us to identify recurring issues and patterns over time, giving us a broader perspective on potential problem areas. Performance assessment shouldn't be overlooked either. Regularly evaluating individual and team performance helps us spot gaps and reinforce accountability. And of course, the management role is pivotal. Leadership must promote a culture of continuous improvement, provide clear guidance, and ensure resources are available for effective error handling. Finally, when proposing CAPA strategies, always keep in mind additional factors like the root cause analysis, the practicality of solutions, and the sustainability of corrective actions. Remember, addressing human errors isn't just about fixing the immediate issue, but fostering an environment that minimizes future risks and supports ongoing quality and safety. Now, let's look at some key strategies we use to monitor and improve CAPA effectiveness. First, we display human error learnings across the relevant areas, which helps us identify patterns and root causes. Then, we communicate these case studies across departments, ensuring everyone is aware and aligned on lessons learned. We also generate monthly reports and trend analyses on human errors, allowing us to track progress over time. With this data, we analyze the trends to see if the measures we've implemented are actually reducing errors. This ongoing review feeds into our quality management review meetings, often called the Quality Council, where we discuss broader quality issues and improvement opportunities. Finally, we conduct an annual assessment that includes recommendations for any weak areas identified during the year. This comprehensive approach ensures we're not only reactive, but proactive in continuously improving our processes and reducing errors. It's all about creating a culture of learning, accountability, and sustained improvement. For further support, please feel free to contact us. We're here to help with any questions or additional information you might need. And with that, I want to thank you all for your time and attention today. Your engagement is truly appreciated, and I hope you found this presentation valuable. Remember, we're always available to assist you as you apply what you've learned. Thank you again.